Casey, why hasn't the current lockdown in Melbourne and surrounds produced better results?
Well, David, the actions of Melburnians have been mitigating the effects of SARS-CoV-2, but you're right, they're yet to aggressively suppress it. Small tweaks to these rules haven't bent this curve, so now it seems like the hammer is about to come down. It goes without saying that the planned lockdown end in 2.5 weeks. Well, that's clearly not going to happen. Daniel Andrews has been laying the groundwork for more. Workplace outbreaks have been the focus for some time, but yesterday he did acknowledge that community transmission numbers are remaining stubbornly high. On average, authorities are now closing more investigations into cases without finding a source of infection than they ever have before. And while known clusters can be brought under control, you can't suppress this virus while these numbers remain this high. And it's hard to do that, to bring those numbers down, without some form of broad community-wide measures. We are still seeing residents of nursing homes being infected at record levels. There are now more than 9 times as many nursing home residents infected than there were nationally than there were at the start of last month. And sadly, 112 of those people have now died. That is more than half of Australia's total death toll to date. And there are still more than 500 nursing home residents actively infected. This is not going to end well. New postcode level data that we've received this week starts to paint a picture that the virus is not infecting and spreading through certain areas as easily as it is others. Melbourne's 25% most disadvantaged postcodes have recorded nearly half of all of Victoria's infections. The least quarter of the disadvantaged postcodes in Melbourne have recorded less than 10% of them. In the other states, border quarantine rules in South Australia and the Northern Territory have this week prevented this virus from getting into those communities, while Queensland is now battling local transmission, and time will tell if that can be stamped out. New South Wales has this week and yesterday recorded its first COVID-19 death in 71 days. Locally acquired cases are growing, but exceedingly slowly. The average has been between 10 and 15 cases a day now for the best part of 2 weeks. And David, that's far more stable than Victoria's numbers were when it was recording numbers like this a month and a half ago.